I guess I'm recording. Hello again. We're back and we're going to continue our video lecture about coding diseases of blood and blood disorders. We'll get into anemia, the different types of anemia, and how we assign codes for them, and other related topics. So, we ended with our last video lecture by talking about the different types of blood cells. Let's talk about the different types of diseases related to these blood cells. Anemia means that there aren't enough red blood cells, hemoglobin, or packed red blood cells, and we can measure this on lab tests. Some symptoms of anemia include pale skin, shortness of breath, heart palpitations, murmurs, fatigue, and other symptoms. Of course, related to anemia, there's several different types of anemia. Nutritional anemias are covered in code categories D50 through D53. Iron deficiency anemia is the most common of these. It can happen when you don't absorb enough iron, lose too much blood, or have an underlying cause that's also coded. Vitamin B12 deficiency anemia is another type. This is caused by problems absorbing B12, not getting enough B12 in your diet, or certain genetic issues. Pernicious anemia is a form of this B12 deficiency. We may also hear this referred to as vegan anemia. This is what they're talking about. Folate deficiency anemia happens when you don't get enough folic acid, which helps make red blood cells. It's common with people that have poor diets, alcoholism, or people that are taking certain medications. Not having enough folic acid can also cause birth defects. Hemolytic anemias that fall in code categories D55 through D59 happen when red blood cells are destroyed faster than when they can be made. This can be caused by autoimmune responses, physical damage, infections, ingesting toxins, or certain medications. Hereditary hemolytic anemias are caused by genetic problems that affect how much red blood cells are made. These cells are fragile and break down easily. Types include G6PD deficiency, pyruvate kinase deficiency, thalassemia, sickle cell, hereditary spherocytosis, elliptocytosis. G6PD deficiency means that the red blood cells lack an enzyme and therefore break down more easily. It's common in men of African or Mediterranean descent. Pyruvate kinase deficiency is similar and more common in the Amish. Both can be triggered by certain foods or certain infections. Thalassemia is an inherited disorder with fewer healthy red blood cells and less hemoglobin. It's more common in people from Southeast Asia, India, China, the Mediterranean, and Africa. Treatment can include transfusions and also even stem cell transplants. Sickle cell disease includes several disorders. The red blood cells are shaped like a C and don't move easily through blood vessels. It affects people of African descent. Treatments can include folic acid, antibiotics, and medications to reduce these faulty cells. Hereditary spherocytosis causes red blood cells to be ball-shaped and have a shorter lifespan. This affects people of Northern European descent. Hereditary elliptocytosis causes oval-shaped cells. Both are treated with folic acid, transfusions, and sometimes even spleen removals. There are other hemoglobinopathies, and these are abnormal hemoglobin types, not otherwise specified. Again, that NOS stands for not otherwise specified. Acquired hemolytic anemias that fall into code category D59 are caused by things like drugs, toxins, diseases, or immune disorders. Treatments can vary and they depend on the cause. They include such things as steroids, IV gamma globulin supplements, transfusion, spleen removal, or even avoiding cold temperatures. Aplastic anemia and other bone marrow failure syndromes falling into code categories D60 through D64 happen when the bone marrow is damaged and can't make enough blood cells. This can be either inherited or acquired. Some causes of aplastic anemia include high dose radiation or chemotherapy, toxins, certain medications, viral infections, autoimmune diseases, and other hereditary conditions. It's also linked to nocturnal hemoglobinuria. Other marrow failure syndromes include such things as Black-Van Dindram syndrome, Fanconi's anemia, drug-induced aplastic anemia, pancytopenia, which can be caused by chemotherapy or other drugs. Acute hemorrhagic anemia is due to sudden blood loss. This could happen either from trauma or surgery. The provider must specify it's from acute or chronic blood loss. If not, postoperative anemia is coded differently. So again, the codes you would assign in this case will depend somewhat on what the physician documents. Coagulation defects and other bleeding problems are serious, and these are caused by missing clotting factors. These could be such things as von Willebrand's disease, hemophilia, and others. The global term thrombocytopenia is the term that's applied for low platelets. It can either be primary or idiopathic, meaning we don't know exactly what's causing it, or secondary to something else. Idiopathic and immune thrombocytopenia, or ITP, is an autoimmune disorder with the development of these antibodies to one's own platelets. Primary thrombocytopenia may also be either congenital or hereditary. And of course, secondary thrombocytopenia is a complication of another disease. Other blood disorders can include neutropenia, which means low neutrophils, seen often in chemotherapy and other medications, bandemia, in other words, too many immature white cells, and other different things. We can also have disorders and diseases of the spleen, including such things as hypersplenism, and some other specified diseases are myelofibrosis, fibrous tissue. In other words, is replacing the normal bone marrow. And we can get progressive anemia resulting from this. We can also have secondary polycythemia, in other words, tissue hypoxia due to COPD, congenital heart disease, or prolonged exposure to high altitudes. Other disorders of blood and blood-forming organs include the heparin-induced thrombocytopenia. This is a life-threatening condition in the state where blood clots more easily, right? And the platelet counts drop sharply after treatment with heparin, right? So a fall in the platelet count by 50% or more occurring 5 to 12 days after heparin therapy is typical. And the treatment is medication that alters this back. In other words, the alternative anticoagulant or direct thromboinhibitor medications that we hear about. Now we're getting into complications during and after spleen surgery. These have their own set of codes, and these include such codes as intraoperative hemorrhages and hematomas of the spleen, accidental punctures and laceration of the spleen, post-procedural hemorrhage and hematoma of the spleen, and the codes identify what the specific complication is and whether the complication occurred during a procedure on the spleen or the complication occurred during another surgical procedure. We would also use an additional code to further identify the complication. And that's all I have for you. Thank you for watching, and we'll see you online. Bye now.